Hello everyone and welcome back to the osteopathy YouTube channel. Today we thought we would look at something a little bit different. So a lot of clients that come in to see us in our clinics ask us, what is the difference between osteopathy, physiotherapy and sports therapy, and which is the right treatment for me? So what is osteopathy? Osteopathy is defined as a system of diagnosis and treatment for a wide range of conditions, and it's considered to be an allied health profession. As an osteopath myself, I find that we tend to try and treat the body as a whole. So even if someone's coming in with a shoulder pain, we're thinking, well, A, why is the pain there? So you're still assessing quite locally, but you want to look around at the whole body. So you're looking at the neck function, upper back, lower body, to see if that might be impacting the shoulder. In addition to this, as osteopaths, we kind of want to look at the body as a whole and the person as a whole. So what we're thinking about is any kind of other stressful triggers that could be impacting. So family stress, work stress, their daily kind of pattern of movement when they're working, in order to give a full treatment plan for each individual. Another really popular therapy that we provide at our clinics is physiotherapy, and we work alongside a huge variety of different physiotherapists. According to the Chartered Society of Physiotherapy, physiotherapy or physiotherapists help people affected by injury, illness or disability through movement, exercise, manual therapy, education and advice. And the therapy is used in order to prevent injury long term. Similar to osteopaths, physiotherapies look at the body as a whole and base their treatment on evidence-based treatment. So we're really similar. I would say osteopaths and physiotherapists work in a very similar way. I would say the main kind of defining feature or difference between the two are the techniques that we use and also the rehabilitation. So physiotherapists may be a lot less hands-on and a lot more exercise-based compared to osteopaths. But again, every single person is different. So there's no two physiotherapists or no two osteopaths that are the same. In addition to this, we also work alongside sports therapists. According to the Society of Sports Therapists, sports therapy is an aspect of healthcare that is specifically concerned with the prevention of injury and the rehabilitation of the patient back to optimal levels of function with regards to sport-specific fitness. So again, very similar to osteopaths and physiotherapists, looking at the idea of evidence-based exercises and rehabilitation programs to help athletes and sports individuals to get back to that high level of performance and prevent injury long term. So one of the summarising points that I would suggest in terms of who's best for you and which treatment should you have is actually trying a lot of different types of therapies. So I would do maybe a little taster of osteopathy, physiotherapy or sports therapy, because the most important thing is what your body responds to and what makes you feel better, because at the end of the day, quite a lot of manual therapists, we work in a very similar way, so it has to be the right treatment for you.